Here is a comparison video for improving dynamic knee stability with a patient who ruptured his left ACL, PCL, and MCL, as well as dislocated his left hip. The first version has a sagittal plane bias. The goal is to maintain balance as the board shifts forward and back, side to side, and up and down. We can see that his base of support is more narrow because he is more stable while shifting his weight from front to back while squatting. From the side view, his ability to maintain balance is clearly visible. For the next comparison, he turns 90 degrees for a frontal plane bias. With the frontal plane, there will be increased movement side to side. This is challenging for him because of his left hip and knee dysfunction. His balance has improved while squatting because of his better weight distribution between his right and left leg. Also, he can squat with a more narrow base of support because of the improved stability. Real change takes time. You have to work hard and be focused. Believe in yourself and you'll get results.